Good morning. Today we're gonna talk about HPV, human papilloma virus, with me, Katherine Shellen Lau, and my friend Hillery Novita Lemsy.
Definition of HPV as a HPV infection is a viral infection that commonly causes skin or mucous membrane growth or warts. There are more than 100 varieties of human papillomavirus or HPV. Some types of human papillomavirus or HPV infection cause warts, and some can cause different types of cancer. How is HPV related to cervical cancer? Certain strains of HPV, most often types 16 and 18, can cause change in the cell of your cervix, a condition called cervical dysplasia. Your cervix is the opening between your vagina and your uterus. Left untreated, cervical dysplasia sometimes advances to cervical cancer. Who does HPV affect? Anyone can become infected with HPV if they have sex or close skin to skin genital contact with a partner with the virus. Similarly, anyone with the virus can spread into their partner during intercourse, oral sex, anal sex, or other close genital contact. How do you get HPV? Genital HPV spread through skin-to-skin contact during intercourse, oral sex, and anal sex. You can get infected if your genitals, including your vulva, vagina, cervix, penis, and scrotum, as well as your rectum and anus, come into contact with the somebody parts on an infected partner. It's possible to spread the virus through head-to-genital contact, like fingering and hand job. This type of transmission is less likely and has been researched less.
When warts do appear, they vary in appearance depending on which kind of HPV is involved. First is genital warts. These appear as flat lesions, small cauliflower like bumps, or tiny stem like protrusions. In women, genital warts appear mostly on the vulva, but can also occur near the anus, on the cervix, or in the vagina. In men, genital warts appear on the penis and scrotum or around the anus. Genital warts rarely cause discomfort or pain, though they may itch or feel tender. And then there's common warts. Common warts appear as rough, raised bumps and usually occur on the hands and fingers. In most cases, common warts are simply unsightly, but they can also be painful or susceptible to injury or bleeding. And then there is plantar warts. Plantar warts are hard, grainy growth that usually appear on the heels or balls of your feet. These warts might cause discomfort. The last is flat warts. Flat warts are flat top, slightly raised lesions. They can appear anywhere, but children usually get them on the face and men tend to get them in the beard area. Women tend to get them on the legs. What tests can be done to diagnose an HPV infection? First is pap smear. A pap smear screens for cervical cancer and precancerous cells that may become cancer or cervical dysplasia if left untreated. Cervical cancer is almost always caused by high-risk HPV. And there is HPV test. HPV test can detect the high-risk strains of the virus that may lead to cervical cancer if left untreated. They aren't any US Food and Drug Administration approved tests for identifying HPV on the vulva, vagina, penis, scrotum, rectum, or anus. HPV related cancers on these body parts are much less common than cervical cancer. Complications. There are several complications that may occur. First is oral and upper respiratory lesions. Some HPV infections cause lesions on your tongue, tonsils, soft palate, or within your larynx and nose. And there's cancer. Certain strains of HPV can cause cervical cancer. These strains might also contribute to cancers of the genitals, anus, mouth, and upper respiratory tract. For the prevention, for the common warts, it's difficult to prevent HPV infections that cause common warts. If you have a common wart, you can prevent the spread of the infection and formation of new warts by not picking at the wart and not biting your nails. For the plantar warts, to reduce the risk of contracting HPV infections that cause plantar warts, wear shoes or sandals in public pools and locker rooms. For genital warts, you can reduce your risk of developing genital warts and other HPV-related genital lesions by being in mutually monogamous sexual relationship, reducing your number of sex partners, using a latex condom, which can reduce your risk of HPV transmission. For the vaccines, the CDC recommends routine HPV vaccination for girls and boys ages 11 and 12, although it can be given as early as age 9. It's ideal for girls and boys to receive the vaccine before they have sexual contact and are exposed to HPV. Research has shown that receiving the vaccine at young age isn't linked to an earlier start of sexual activity. When someone is infected with HPV, the vaccine might not be as effective or might not work at all. Also, response to the vaccine is better at younger ages than older ones. But if given before someone is infected, the vaccine can prevent most cases of cervical cancer. The last is HPV curable? The answer is no. There isn't a cure for HPV. Still, your immune system is incredibly effective at getting rid of the virus of you. Most HPV infections, about 90%, are cleared within a year or two. So that's all from us. Thank you for your attention.